Speaker, Alexandre Mejat. He is a board member of Eurordis since May 2018. He is personally affected by Bethlehem myopathy, and his parents have been involved in the French telethon organization since 1987. He has a PhD in molecular and cellular biology. Alexander is the Scientific International Affairs Manager for AFM Telethon. At each telethon, thousands of volunteers and partners join forces to organize fundraising initiatives all over France and abroad. He will give us more information about the organization and its activities. Alexander, the floor is yours.
Thank you very much. So I will try to share my screen. So right now, do you see it in full screen?
Yes, it's perfect.
Perfect. Thank you very much. So thanks a lot for the invitation. I'm very happy to be here and to be able to introduce a little bit what EFM Telethon is doing. To be transparent, I prepared 45 slides, so I may have to be quick, but I will try to be as clear as possible. So first, the most important thing, I think, is to remember where we come from and who we are. And so I think it's very important to remember everyone that EFM Telethon was created in 1958 by a mother of 7 children, 4 of them being affected by Duchenne myopathy. So this woman is called Yolande Kepper. And so it's very important to understand that EFM Telethon was created by parents of patients and patients right from the beginning. And it didn't change since 1958. So EFM Telethon has 3 missions. Again, 3 missions which were defined in the 1960s and which never changed since. The first one is to care, so try to provide the best standard of care to the patient. To cure, so to invest in research and the therapeutical development to find new treatment for these diseases. And to communicate, so increase awareness in the population about neuromuscular diseases, but more generally, rare diseases. And we have also very strong values. The first one is transparency, and I will talk a little bit about the French Telethon, which is our fundraising event, and that's very important to be fully transparent in the way every euro we collect is used. The second value is innovation, because we really believe that both in the social and medical and scientific fields, there is room for innovation, and that's only through innovation that we will be able to make some progresses both in standard of care and in the research. And even if EFM Telethon was created by neuromuscular disease patient, now EFM Telethon has a general interest strategy, not only for neuromuscular diseases, but for all rare diseases, and more generally for diseases in general, because you'll see that the new treatment we have been helping to develop will be, of course, very useful for rare diseases, but hopefully at one time they will be also used for frequent diseases. So really the goal is to be helpful for everyone. So first, very important thing, as I said, EFM Telethon is and has always been a patient-led organization. So this is one of the pictures of our board of directors. All board of directors are patients or parents of patients, and they are the final governing body of the organization. So every final decision is made by patients or parents of patients, and that's really a core value of EFM Telethon. And right from the beginning, EFM Telethon wanted to help research, and so we had since 1981 a scientific advisory board. So the first scientific advisory board in the 1980s was only composed of about 10 to 12 experts, because at the time the number of experts for these rare diseases were very few. But now EFM Telethon is supported by a scientific advisory board, including 90 permanent scientific and clinical experts. But we also have a database of more than 5,000 experts in the rare disease field all around the world. So a lot of expertise helping the patient to make the right decision. And the scientific advisory board has been very important too, because right from the 1990s, as EAMDA is doing, they proposed to EFM to organize a scientific meeting. And this scientific meeting were particularly important. And particularly one of them, the scientific meeting organized in 1986 in France, because in 1986, we had a huge news from Anthony Monaco, an American researcher, who came to this meeting to announce that he identified a mutation in a gene called dystrophin, and that this mutation was responsible for Duchenne myopathy. And why was it such a big, important news? Because it was the first time that the cause of one of these neuromuscular diseases was identified, and the cause was a genetic cause. So, you know, I know that maybe for the youngest of you, you don't remember the time before this discovery, but at the time we heard stupid things such as, you know, the mother had a misbehavior during the pregnancy, or it was some kind of curse or whatever. So lots of stupid hypotheses to try to explain these diseases. But from this discovery, we knew they were of genetic origin, and we finally had a start to try to understand the mechanism of this pathology, and hopefully at the time to develop new therapy to cure them. So really 1986 was a very important date for EFM Teleton, and particularly thanks to this interaction between the Scientific Advisory Board and the patient organization. And then the patient organization asked the Scientific Advisory Board, what should we do now? What is the next step? And their answer were, first, you need to invest a lot in genetic, because in 1986, we didn't know about the human genome. We didn't know the sequence of the gene. We didn't know the mutations implicated in rare diseases. And the second answer was, you need to fundraise money. Because unfortunately, if you want to invest in research, if you want to invest in genetic, you will need a lot of money. And so from this announcement, EFM Teleton sent a few of its board members in the US to look at a specific fundraising event called Teleton, organized in the USA. And thanks to what we learned in the USA, we were able to launch the first French Teleton in 1987. So I have immediately to say that first, this French Teleton was a huge success. Because I don't know if you see the amount of money which was collected at the time, but what is important on the picture is that the 1 and the 6 at the beginning are not exactly aligned. And the reason is that initially we had a counter with only 7 numbers, because we expected no more than 9,999,000 euro. And the truth is that we reached almost 200 million euro franc at this time. And so the TV had to add numbers. These numbers were painted on wood panels in the backstage of the TV show. So that's why the numbers are not aligned. And so the French Teleton since 1987 is a huge success. But what is very important to understand is that Teleton is not only a TV show as it is in the US. What was very, very important for us was that people will not only be spectator of this event, but would be actor of this event. And so now the French Teleton is a TV show, but it's only 20,000 events all around France. So people dancing, doing sports challenges, having a dinner, organizing a lottery, 20,000 events all around France, 200,000 volunteers implicated in the Teletons during one weekend. And so we just had the 2022 Teleton 2 weeks ago, and we were able to fundraise more than 78 million euro, which is a huge tool for us to do better things. And just quickly to show innovation, we continue to innovate on the Teleton. And for example, in November, we had a Teleton gaming challenge, which is trying to mobilize and to implicate YouTubers, gamers online to reach this new young community and implicate them in the Teleton. And again, it was a great success. They were able to raise more than 200,000 euro, but more importantly, they were able to increase awareness on these rare diseases with this young community, which is highly connected to internet. So thanks to the Teleton and the fundraise event, we are able to invest in innovation, both on the social side and on the treatment side. So as I said, we got three missions. The first one is care. And since 1988, so since the first Teleton success, we were able to invest in social care by inventing a new job. So yesterday we had a talking about coordinator. So the coordinator was able to coordinate all the appointments with clinicians and to accompany the patient in the medical journey. We almost invented the same kind of role since 1988, but these people are accompanying the patient in everyday life issues. So not only the medical journey, but also to identify a physiotherapist able to come home and knowing neuromuscular diseases, helping the patients to adapt the house and fill all the documents to get some reimbursement for wheelchair, for a ramp, to make modification in the house. They can accompany the parents to meet the teacher at school and to explain to the teachers, but also to the other students, what is the life with a rare disease and how to integrate these young students in normal school. So really we have this, we now have about 200 people in France who are professionals accompanying 15,000 families in France every day in all their issues in everyday life. The second thing was to advocate a lot so that the law will evolve and integrate all the needs of patients affected by rare diseases. And one of the important steps in France was a law which was adopted in 2005, which finally recognized some rights for people with handicap. The first one was the right to get access to school, which of course is a very, very important one. The second one was the access to training, university, but also employment. And the third right was the right for compensation, which means that all the needed tools, I was talking about wheelchairs, for example, should be reimbursed and should be supported by the society so that the patient have all the tools they need to have as normal as possible life. We also developed what we call respite homes, because as you know, when there's someone affected by a neuromuscular disease in the family, the whole family is affected. And there's a lot of burden in everyday life for every member of the family. So we needed to have spaces and places which were adapted to the neuromuscular diseases and which was able to host and welcome families for a time where there were also medical and social professionals to support the family, and where the family could just take some rest and come back to an almost normal life for some time. So we have free respite homes in France, allowing families to take some rest. As I said, EFM Teleton, thanks to the success of the Teleton, really always wanted to have a general interest strategy. So not only focusing on neuromuscular diseases, but trying to move the whole rare disease field forward. And so during Teleton, we have this very symbolic walk where you have all these people walking around Paris with signs with the names of all these rare diseases. But that's just a symbol of the support provided by EFM Teleton to the rare disease field in general. More particularly, we have in France what we call the Rare Diseases Platform, which is a group of initiatives, both national and international, to support the rare disease field. So the first tool is Rare Disease Helpline, which can be called when you are diagnosed with a rare disease to get the right contact for a medical expert and patient organization. EFM Teleton has been supporting the Orphanet database since its creation. Initially, it was imagined as a French database, but now it's translated in more than 60 languages, and it became a worldwide database for rare diseases. So it's really a tool which is now used worldwide by all rare disease experts. As you know, we are supporting at the national level our French Rare Disease Alliance, but we are also supporting Eurordis at the European level. And at the national level, we also support a rare disease foundation, which will fund research on rare diseases. So we try to combine different initiatives and tools to really provide a support to the whole rare disease field, both at the national and international level. And at the national level, we have been also advocating to get rare disease national plan. So in France, we were lucky to have the first French rare disease national plan in 2005. Two important things are that first, you need to fight to get these rare disease national plans if you don't have one yet. And second, I think it's very important to have these national plans regularly updated and reevaluated. So in France, a national plan is usually about 5 years. So we are currently finishing the third national plan, and we are renegotiating the fourth French rare disease national plan. And I realize that in some countries where there are national plans, they haven't been updated or changed since more than 10 years. So that's very important to get a national plan, but also to agree with the government to regularly reevaluate this national plan to adapt it to the new evolution. So the second mission, as I said, is to cure. And we invested a lot in innovation to find a new treatment. But before being able to develop new treatment, what was needed to actually increase the knowledge on rare diseases. And so in 1990, as I said, when we had this first telethon, there was no knowledge on genetics and on the human genome. So before working on developing new treatment, we had to invest on the human genome. So at the time, as you said, the human genome is some kind of genetic test composed of 3.4 billion characters, which is an equivalent of about 2 million pages. And at the time, with the technology we had in the 1990s, we were able to read the equivalent of 1 page, but without knowing if we were reading the introduction of the document, the chapter 2, or the conclusion. So before reading the 3.4 billion characters, what was needed was some kind of map to be able to put the different pieces of the text in the right order. And so EFM Telethon, thanks to the money raised by the Telethon, created a first laboratory called Geneton. And the first mission of Geneton was to build the human genome map. And so the first success of EFM Telethon was in 1992, where we published the first human genome maps. So it's not the full genome, but it's some kind of signs all along the genome, which will allow to then put all the pieces of the genome in the right order. It was a very important step for research because it really helped accelerating the sequencing of the human genome. But it was not only a success for research, it was also a success for human rights, because in 1993, EFM Telethon offered the human genome map to the UNESCO. And it was a very important thing because due to this gift to UNESCO, UNESCO announced in 1987, it always takes some time, the Universal Declaration on Human Genome and Human Rights. And the first article of this declaration was that the human genome should be considered as a heritage of humanity or part of the human patrimony. And why was it so important? Because as it's part of the, as it's an heritage of the whole humanity, it cannot be patented. So if now it's not allowed to patent any part of the genome, it's thanks to the fact that in 1992, EFM offered the human genome map to UNESCO. We also promoted the creation and funding of DNA banks, and particularly one in Geneton, our laboratory, which is one of the biggest DNA banks in the world. Right now in Geneton, they got more than 400,000 samples representing about a few thousands different rare diseases. So really a huge DNA bank, which is totally open to any collaboration with any researcher in the world. And it's maybe also important for you to know that Geneton is able to host a collection from worldwide researchers. So I discussed recently with a researcher in the USA and a small patient foundation, and they said they didn't have the money to maintain their DNA bank in the US because it was too costly. And they realized that actually Geneton could host their collection for a very cheap price. So if you got clinicians with DNA banks who said, oh, I cannot maintain my bank anymore because it's too expensive, don't hesitate to contact Geneton. We may have a solution to make sure that these samples are not lost. So right now, as you know, we consider there are about 6,000 to 8,000 different rare diseases. Unfortunately, the genes responsible for this disease have been identified only for about half of them. But during the time Geneton has been working on genetic, Geneton has been able to identify about 400 genes responsible of different rare genetic diseases. So at the end of the 90s, we thought that it was time to move from genetic to development of new therapy. As I said, we initially created a first laboratory called Geneton, but we then built two other laboratories. The second one is called EAMDA, and the third one is Institute of Myology. And I will try to show you very quickly that these three laboratories are complementary. Geneton is developing gene therapy, EAMDA is developing cell therapy and drug screening, and the Institute of Myology is a clinical trial center where these new therapy can be actually tested in clinical trials. So as I said, Geneton moved from genetic to gene therapy development, and they focused on the development of this, what is called a gene therapy vector. So it's actually modifying a virus in which you will remove all the genes of the virus and put the gene you want to have transferred in the cell. And thanks to this modified virus, we can now have these genes transferred in the cells where they are needed. So Geneton has been working on developing new gene therapy vectors starting in 1997. And I will show you at the end of this presentation a few successes we could obtain thanks to this gene therapy development. The second institute, as I said, is called iStem. It's a stem cell expert institute. And they try to use stem cells for two applications. The first application is what is called cell therapy, where you actually imagine to replace the non-working cells by new cells using some kind of classical graft. Right now, I will show you a small example of this kind of cell therapy. There are a few applications for cell therapy, but it's still very difficult to imagine to cure someone with cell therapy. A second thing which can be done is actually use cells from patients to create cellular model of the disease that you can have in a dish in a laboratory and test the drugs on these cells. So that's what is done by EAMDA with a lot of robots being able to test hundreds and thousands of drugs 24 hours a day, 7 days a week. And the last institute is the Institute of Myology, which is both a clinical center where patients can have their multidisciplinary patient follow-up. It's also a research center where we have more than 250 research experts. They are trying to understand the mechanism of neuromuscular diseases, but they are also trying to develop new tools for clinical trials. And so, for example, they have been developing specific outcome measures tools and devices to measure the force of the arm and the force of the hand. Because as you may know, before the efficiency of gene therapy for muscle disease was tested using the 6-minute walk test. But if you are in a wheelchair and can't walk anymore, this kind of test is absolutely useless. So there was a need for new outcome measures applied to the hand and to the arm. And we also have now iMotion, which is a new part of the institute dedicated to pediatric clinical trial. It's really a clinical trial center expert where more than 40 clinical trials have been hosted since its creation. So again, a very complementary group of institute developing new therapy, gene therapy, cell therapy, drug screening, and then clinical center and clinical trial center dedicated to validating this new therapy. So and I will now very quickly go into a few of our success, but also to show you all the way which has been done since the beginning. As I said, Geneton started developing a gene therapy vector in 1997, and we were very happy to have our first success in 2000. So 2000 was the first gene therapy success in the world, and it was done thanks to a gene therapy developed by Geneton. It was applied to a disease affecting the immune system of babies. So due to the fact that these babies do not have the immune system, they have to live in a fully, sorry, I'm losing my word.
Sterile or enclosed?
Yes, so they need to live in a place where there's no virus or bacteria, and so they can't live in the normal world, and they are blocked in this fully blocked system. What was done at the time was that cells from this baby were collected, and they were treated outside of the body using a gene therapy vector, which was able to bring the missing gene in these immune system cells. And then once these cells have been corrected, they have been reinjected in the babies. And hopefully we were looking for these cells to be able to regenerate a fully functional immune system. And that's what happened, because a few weeks after the injection, these babies were able to go out from their locked place and to actually have a completely normal life. Now we are in 2022, and these patients now have fully normal life. We can consider that they are totally cured from this immune system disease. It was the first success for gene therapy, but as I explained, it was done by taking cells out of the body and treating cells out of the body. And it was needed to improve the system to be able to treat the tissue and organs internally. So then EFM Teleton has been funding research on gene therapy in vivo, where the gene therapy vector is directly injected into the organ, first in the eyes, because it's quite easy to access the eye. And as you may know, it's now a fully approved treatment called Luxturna, which is available for patients. So second success of gene therapy, this time not ex vivo, but in vivo. And what we realized is that gene therapy doesn't work if you arrive too late in the disease, because if the cells are dead, there's nothing to correct anymore. So we have been also developing a cell therapy where, using stem cells, we are able to produce retinal cells and to graft these new retinal cells in the eyes of the patient to replace the cells which are missing. So the clinical trial is ongoing, but hopefully we will be able to propose to these patients not only gene therapy, but also cell therapy. A second in vivo gene therapy where we directly injected the gene therapy into the organ was brain gene therapy. And EFM Teleton has been supporting research on two rare diseases called adrenoleukodystrophy and Sanfilippo diseases, with some great successes. So we went from outside of the body to inside of the body, but by injecting directly into the body. And as you know, that's not a strategy which can be applied to muscle, because we cannot imagine to inject into the 640 muscles everywhere in the body. So we needed to reach a next step, which was to inject intravenously in the blood the gene therapy vector, and see if the gene therapy vector was able to travel into the body and find the tissue to be cured. And so to do so, we proved it on a liver disease called Crigler-Najjar syndrome, where these patients are missing an enzyme in the liver. And what was done was that the gene therapy vector was injected in the blood of this patient. The gene therapy vector was able to travel into the body, find the liver, and bring the genes missing into the liver cell. So again, it's a clinical trial which is ongoing, but with, again, some good success. And it was a proof that it was now possible to go in vivo without injecting directly into the organ, but injecting intravenously. So when you reach this step, you can start developing gene therapy for neuromuscular diseases, because you can imagine to inject in the blood and have the vector going into all the muscles of the body. So as you may know, we had a huge success with myotubular myopathy, which is a very severe pathology. Unfortunately, I can't show you a video, but it was hugely impressive with patients who are supposed to die around 3 to 4 years of age without being able to stand, without being able to sit, needing some ventilatory support. And in France, we have a young patient who has been treated It doesn't need anymore to have any ventilatory support. Is able to eat autonomously, is able to sit, is able to stand, is able to walk. And very recently, we received a video where he is able to climb stairs. It was not, we couldn't imagine such improvement. And of course, maybe you didn't hear about myotubular myopathy, but I'm sure you heard about SMA. And so for me, that's very important to let you know that all the SMA development for gene therapy is linked to EFM activity. And actually, it completely recapitulates all the things I've been telling you. So in 1988, when we created the first DNA bank, the families of patients affected by SMA all came together to collect blood samples and to start looking for the gene implicated in SMA. In 1990, that's actually the Geneton laboratory, which was able to identify in which part of the genome the gene responsible for SMA should be located. And in 1995, it's a team funded and supported by EFM Teleton, the team of Judith Melki, who was able to exactly identify the SMN1 gene and the mutation responsible for SMA. So the gene identification for SMA is fully integrated in EFM's story. And then once we got the gene, again, it was a team from the Institute of Myology in France, which developed a gene therapy and proved the efficiency of the gene therapy applied to SMA, leading to the 2015 clinical trial. And as you say, this new treatment called Zolgensma got its approval, market authorization in the USA and Europe in 2019. So it took 30 years to go from gene identification to a treatment, but it showed also all the steps where EFM Teleton tried to push the field forward. My last two slides. First, what is the next step? Right now, there's one point where France is not at the top. It's newborn screening. We are still fighting with the government to get newborn screening. And we just started a few days ago, so it's really new, a pilot experiment to get newborn screening for SMA. And that's the first genetic disease in France for which there's a pilot. So we are far still from having a full newborn screening for genetic disease in France, but hopefully we will be able to convince the government to apply it as quickly as possible, because as you know, that's clearly urgent. And that's really one of the things we are fighting for. My conclusion, that's a sentence that our president used very often. And I think everyone around this conference should be convinced about it. It's not from our president, it's not from me, it's from Margaret Mead, who said, never doubt that a small group of thoughtful and committed citizens can change the world. Indeed, it is the only thing that ever has. So stay committed, stay thoughtful, and never forget that you are changing the world. Thank you very much for your attention.
Thank you, Alexandre. If anyone has any questions, please feel free to ask them.
I have a comment. Sorry. Thank you, Alexandre, for this presentation. Even if I believe that I know something about EAMDA Teleton, I have to recognize that I didn't know a lot from your presentation. And it's impressive for all of us, I'm sure, and very inspirational to follow this evolution. It's incredible. And I was thinking that the right characterization of your organization is the sky is limit, or the sky is no more the limit. But I think it's very impressive what EFM have realized over the years, and it's very important to hear this more among the patient organizations. I think it's the first time when I see a presentation of EFM Teleton. I heard many things all the time, but I never seen a presentation until today. So I'm very happy that I had this opportunity. So thank you, Alexandre.
Thank you. Onur, you're next.
Yes, thank you. Yes, I definitely agree with Dorika. It was very impressive. I did know FM Teleton, but I didn't have such a knowledge actually. Thank you very much for your presentation and all achievements and contributions so far. My question would be, Alexander, is something that I have been achieving over since I joined this world because of my daughter. How have you been able to manage this sustainability of income? Because apparently there have been a lot of investments. What's the reason? Is it just fundraising, or is there any other way?
So first, to be totally transparent, every year it's a huge stress because we don't know the miracle recipe, and we always think, oh, maybe people could stop supporting us. So we unfortunately don't know why people continue to support us. It's a miracle every year. Now, to give you a few things. First, again, I think what's a very important thing is that we ask people to be actor of this fundraising event and not spectator. In the US, the Teleton has been stopped for a few years because nobody was watching the TV anymore, and because people didn't want to spend their time just in front of the TV. So a big part of the success of Teleton is that really we got all the students in school doing challenges. We got all the little villages in France organizing a dinner where everyone is happy to come together and to spend some time together. We got all the sport federation building challenges. So I really think one of the reasons why people are happy to participate to the Teleton is because they have these moments together where they share their passion, their activity. You know, it's like I will not take the McDonald's sentence, but usually at Teleton we say, "Come as you are." You know, don't try to imagine anything new to participate to the Teleton. If you know how to dance, dance for the Teleton. If you know how to run, run for the Teleton. If you know how to cook, cook for the Teleton. And I think that's really part of the success. The second thing is that, as I said, we needed to adapt with time, because we know that the TV has been changing. You know, in the 1980s, you had no choice. There were 3 channels. And when you started your TV, you had to watch what was on the TV. Now with Netflix and all these new platforms, you can choose when you want to watch and what you want to watch. So it's more difficult to get people watching the TV. And so that's why now we are trying to invade or occupy these new platforms such as Twitch, YouTube, Instagram. And again, yeah, it works, but it takes time. Right now, as I said, we just got a few 100,000 euro, but we are building, and year after year it becomes better. What else? I think, as I said, that there are also 2 things which are very important. Transparency. I think we have been, right from the beginning, we have been very, very, very strict on all the transparency. People should have no doubt on the way you manage the money. And second, you need to show result. So actually, it's a little bit easier right now to fundraise because we got result. We can come to the TV and say, look, these are children which have been saved or cured thanks to you. It has been a little bit harder when we were in the preclinical time, because when you say to people, oh, we just saved the mouse, people were not as happy. You know, they understood it was a needed step to reach the patient. But yeah, of course, since we got result, it's easier. But as we got result very quickly, as I said it, in the 1990s, we could call about we could talk about the progress in genetics. In 2000, we started having successes with immune system, and every year we had new project where we could have success to present. But of course, since we got Zolgensma and myotubularin, and we can really show that we can make a difference for the neuromuscular disease field.
Okay, thank you. And one more question, please. And how do you split the income that you receive, based on all, because you are representing the entire muscular diseases, right? Yeah. Or genetic related diseases. So how do you split the income to each disease? Is there a specific way that you are
No,
following?
so that's also a point which is very important. We have always explained to people that if we try to divide the money pathology per pathology, we will make no difference. So, you know, for the first telethon, we got 180 million francs, which was a huge amount. But if you divided by each patient affected by a neuromuscular diseases, each of them would have had 10,000, and that's it. It was not enough to pay a wheelchair, and you didn't make a change. So that's why I said we have a general interest strategy, and we really invested in tools which could be useful for the whole community. That's usually what I try to say to the patient organization. Usually I've got contact with SMA Europe, FSHD Europe, WDO, and they come to us and say, oh, how much do you invest on Duchenne? How much do you invest on SMA? And that's not the way to look at things. We invest in gene therapy. And once we got a vector which is able to enter into the muscle, we can use this vector for hopefully as many pathology as possible. Once we got a tool which is able to cure something in the brain, you can then try to cure as many brain pathology as possible. So we really try to have this kind of strategy, which is developing tools which will be transversal and usable for as many pathology as possible.
Okay. Yeah. Last thing.
Thank you.
Yeah. Thanks. One more thing. Will it be possible to get your contact details?
That was I was about to say. I will put my email address in the chat. You're also very free to ask it to Ipek and Arabella. They got them. And please don't hesitate to be in touch with me. We had in the past a few group of patients coming from other organizations during the telethon to just see how it is organized. So don't hesitate. We would welcome you.
Thank
Thanks
you very much.
for your attention and your questions.